Great day, everyone. Welcome. You're watching Liberate Yourself from Chronic Pain with yours truly, Stephen Simon. It's great to be back with you guys in full effect. And today I want to talk to you guys about managing your medicines, right? Okay, so let's get straight into it. You might want to grab a pen and paper and, or even watch this again. But before I start, give this video a thumbs up, a like, and a share. And let's get started. All right. Hope everyone's doing well, feeling great, and healthy, and energetic, and just awesome. All right. Let's go. So, medications can be an important part of managing your chronic condition, right? But they don't cure it. That's the problem. They don't cure it. And I'm gonna play devil's advocate a bit. But if medications, medicine did cure your condition, your health, then doctors and nurses and the whole pharmaceutical industry wouldn't be around for long, right? They wouldn't have a job because they'd be curing everyone's illness. Why is this blurry? Okay, you guys see me okay? There we go. Right? Pharmaceutical companies wouldn't, if they cured diseases, they wouldn't have a job for long. So they kind of like put a band-aid on it and you come back for more. So, but we're not talking about that. We're going to talk about how how we use it, medications, to cure your condition. Sorry, not cure your condition, they don't cure it, but help manage your condition, okay? So medicines generally serve like 4 different purposes, basically. They serve a purpose to, number 1, relieve symptoms, number 2, prevent further problems, and number 3, they help to improve or slow the process of a disease, right? And then number 4, medicines replace substances that the body is no longer producing adequately. Okay, so such medicines that relieve symptoms would be like excuse me if I'm not pronouncing it right, but acetaminophen, right, which is Tylenol, is used to relieve pain. Then you have a type of medicines like nitroglycerin tablet, which expands blood vessels, allowing more blood to reach the heart, right? And then you also have like an antidepressant medicine, which can lighten depression and improve your mood. So that falls in the relieve symptoms category. In the medicines that prevent further problems would be medications, for example, that like a blood thinner, for example. So it may thin the blood and help prevent blood clots, which cause like strokes and heart and lung problems. Okay, so that's that category, preventing further problems. Then you have medications that improve or slow the process down of a disease. So a non-steroidal anti-inflammatory drugs can help arthritis by quieting the inflammatory process, right? Likewise, like a anti-hypertensive drug. So meaning, if you have high blood pressure, medications that can lower the blood pressure. So that's 3: improve or slow down the progress of a disease, prevent further problems, relieve symptoms, and the last one, number 4, is to replace substances that the body is no longer producing adequately. So what that means is like insulin, for example. Insulin is used to manage diabetes and thyroid medications for underactive thyroids in the body. Okay, so when you take medications to relieve symptoms such as pain, depression, or anxiety, you expect to get relief from your symptoms right away, right? I do. As soon as you put in your mouth, you want that relief within the 5-10 minutes. But unfortunately, not all medications work like that, right? Some medications has to build up in your body before you will experience any relief. Okay. For example, I take this hydroxyurea medication, and it's a type of medication that every month I have to get my blood checked to see where my levels are in this, and how so that they know how much to give me, how many I should be taking. But this type of drug, for example, it doesn't necessarily relieve pain, but what it does do, let's say if I need a blood transfusion, it stops me from having the need for frequent blood transfusions. It doesn't necessarily relieve the pain, but it reduces the amount of pain episodes that I have, right? So that's something that it has to be built up in my body first before I can necessarily see the results of it. It's not something I put in my mouth and then all of a sudden my pain is gone. This kind of drug doesn't work like that, okay? But this hydroxyurea is something that it's actually a chemo drug, okay? So it's a chemo drug that can help people live longer. It can be used for people that have certain types of skin cancer, leukemia, and like myself, sickle cell anemia, right? So that's how that works, and that's an example of type of drugs that have to be built up in your body first before you see the effects of it. Now, if you're experiencing something like that, you think that you're taking a drug and you're not getting the results, it's important that you talk to your doctor or your nurse practitioner about how long you need to take the medicine. Okay, so that's very important. How long you need to take the medicine before deciding that it's not right for you, right? So when a medication, its purpose is to lessen the consequence of the disease, right, or slow down its course, like we discussed with the examples earlier, you may not be aware that the medication is doing anything, and this may make you feel that the drug isn't working, but it's important to continue taking the medication, even though you cannot see or feel how they are helping your body, right? Okay, so if this concerns you, ask your healthcare provider. As I said, speak to your doctor, speak to your nurse practitioner, and see how they can help you, and maybe they can help you realize the effects of what it's doing for you, even though you may not necessarily be feeling the effects of reduced pain. Okay, so that's all I have for you today with managing your medicines, but I'll be back again soon, and we will discuss further type of medication type related topics. Okay, so stay tuned. If you got any value from this video, hit a like and a share, and hey, I love you, I appreciate you. Thank you for watching. Liberate yourself from chronic pain with yours truly, Stephen Simon.